Today we'll get the result of my laboratory. I hope I am fine. What floor? Third floor. What is the result now? Tell me the result. I feel like dizzy.
Yes.
That's the name of the doctor. Perla Hernandez. Hi, doctora. How are you? Gracias.
Sí, está, se muerde el miedo.
No, es endometriósico, por eso le estamos dando otra vez cirugía.
Sí, no.
I thought it's gonna be ugly the result, but
No, I told you. Doctora would have told us that day.
Está muy bien, ella afortunadamente todo bien. Y hay que cuidarla por la válvula, por las... Son una muñequita de cristal.
Sí. Abusa esa desgracia.
Con una muñequita de cristal.
Abusa porque sabe que hay que tratar, abusa.
Es una muñequita de cristal. Y cuando te la conocí así comía, no comía aquí cada 3 horas.
Pero no le tenía yo que hacer. Ella se hacía. Ahorita su servidor es el que la hace.
Me gustaría que se descuiden.
No.
Porque si se está formando algo, yo puedo dar un medicamento para que se seque esa cosa y que no vaya a haber una necesidad de tener que volver a meter a quirófano.
Salvo su mejor opinión, pero después de los 6 meses que terminemos, no tiene caso hacerse, ¿verdad? No tiene, porque no se ha formado nada.
Exactamente, es una vez al año. Y si detectamos algo, inmediatamente ese va a ser su medicamento porque no puede tomar estrógenos.
so here in the hospital of Galilea, I'm sitting down here. I wanna get something to eat because I'm exhausted. And the result of my lab test was very good. She's my doctor, Dr. Perla Hernandez in Galilea Hospital. She's very good doctor. Anyway, I thank God that the result of my cancer test was negative. It turned out very good, so I'm glad. So I'm glad with the result of my blood test. It turned out negative from cancer cells. Well, cappuccino. I still have a lot of roses from the injections, left and right. So I'm out of the hospital now. Thanks God. Later on, guys, I will tell you how does it feel to get sick. To be sick, I mean, to be sick of it's not ovary, amol. It's fallopian tubes. Cyst in the fallopian tubes. And then when the doctor removes my fallopian tubes, one of it, and how many days I recover from the hospital. So I'm still kind of weak. It's been 12 days from the surgery date. I am sort of fine now. Still under recovery. So I'll be right back to you later, guys. So here we go, guys. Let's talk about the symptoms of cyst in the fallopian tubes or cyst in the ovaries, because more or less they have the same symptoms, and even colitis is almost more or less the same symptoms with ovarian cyst. But in my case, at the beginning, the doctor thought that I have an ovarian cyst because all the symptoms go with the same problem. But when she started opening my tummy, she realized that the problem is not in the ovary. My ovary are both healthy, but the cyst was in my fallopian tubes. So, and one is already erupted, so she has to cut the fallopian tube, only one side, and the other side is good. So that's why they said that it's a partial salpingectomy, the removal of one fallopian tubes. So here let's talk about the symptoms of this common woman sickness. First is the pelvic pain. You have the pain right here, like you don't understand. I cannot be like relaxed all the time. There's always like something bothering inside. That's why we went many times to the doctor, but usually almost all the doctors said that it's a colitis, so I'm taking medication for colitis and it relaxes me anyway. So I thought, oh, it's just a simple colitis. For years, until I decided to go to a specialist, and this doctora is just very good, and she found out that I have the problem in the fallopian tube anyway. Well, the second problem, the second symptoms for this problem is intense abdominal pain. So you always have the abdominal pain like you have the period most of the time, but intense. You cannot relax most of the time. Okay. The next one is dizziness and vomiting. This problem I don't have. I don't feel this. I don't feel like I'm dizzy. I don't feel like vomit. Nothing. I have no sensations of like, oh, I like to vomit. No, but most of the patient feel this, and also the fever. They have this fever symptoms. But in my part, I really don't have fever. Nothing at all. No fever, no dizziness, no vomiting. Okay. So another one is the heavy period. And this one is I suffer a lot. Every month I suffer a heavy period, but very heavy and very painful. Like from 0 to 10, the pain was like 10 to 12. Really painful. So another one is bloating. My stomach always bloats. If I feel like full all the time. Like even I ate very little, I feel like I'm very full. Like I ate a lot, and sometimes I cannot breathe very well because I'm very full. And another one is I always feel like thirsty. So I drink water all the time and drink even in the middle of the night. I keep on drinking. And then I feel like going to the bathroom most of the time to pee. I like to pee all the time. And then when I go to the bathroom, there's very little pee. And then after I go back to bed, I want to pee again. So it's just a common symptoms. But anyway, this problem is very common for women, no? So do not be relaxed, guys. If you feel the symptoms, go to a gynecologist before it become worse. So most ovarian cyst or the fallopian cyst in the fallopian tubes, they said that it occur naturally and it will go away in a few months without needing any treatments. But in my case, it's already erupted, so it has to be treated and in the emergency. So for everyone, if all the mentioned above, you have this, please go to the doctors right away, especially to the gynecologist, because sometimes if you go to a wrong doctor, of course they will give you a negative result. Because here in Mexico, I have a free medications, we have insurance, we will be in the doctor most of the time, but they didn't tell me about sickness I had, about this problem. I have the Papa Nicolau, I have the breast check up and ovary check up every year, but everything is fine until I decided to go to the gynecologist, and the gynecologist says that I have this cyst problem. And now I have in like 12 days from after the operation, and then now I feel better. I already walk, but I cannot stand very much. Look, let me stand up. I'm holding my body like that. So I walk like this. It's still very painful. So that's all for now, guys. Like I said, if symptoms persist, consult your doctor right away, okay? So I still have this process because of the injections, a lot of injections when I was in the hospital. And I also hear an injection here, and there are a lot of injections and so painful needles. So beware, guys, be careful. I love you. Bye.